In this episode, Dr. Lauren is joined by Henry Lucas, CEO of the Kentucky Harm Reduction Coalition. Together, they discuss the importance of community engagement, recovery stigmas, and the future of harm reduction efforts. This is the Well Aware Podcast.
Hi, guys. Welcome to the Well Aware Podcast. I'm Dr. Lauren Grawert, Chief Medical Officer here at Aware Recovery Care. Today, we have a special episode near and dear to my heart on harm reduction and the context it plays with addiction treatment. Our special guest is a CEO of the Kentucky Harm Reduction Coalition. He's a licensed clinical social worker, a licensed clinical alcohol and drug counselor who specializes in trauma and addiction treatment, and the author of a best-selling book called Maximize. Join us as we explore this important topic. So, Henry, welcome. Thanks for joining us. Where does this podcast find you today?
Yeah, I'm in Bardstown, Kentucky, which is Nelson County. It's about 45 minutes south of the big city of Louisville. I'm right in Kentucky. I'm at one of our office locations here. Thanks for having me on.
Thank you for coming on, and welcome to our podcast. And it's also great to meet a fellow Southerner as well.
Yeah, likewise.
Can you tell us a little bit about your journey into the field of trauma and addiction treatment? What inspired you to focus on this area as you got started in your career?
Yeah, I think for me, it goes back to a lot of my lived experience, a lot of my childhood experiences. I am a survivor of the opioid epidemic. I became addicted to OxyContin at 14 years old and found myself in treatment at 24. And after some time, in recovery, decided I wanted to go to school to help people. And so I enrolled into university and went through the gauntlet of courses and supervision to get here. And although it is very similar to what I originally committed to, it's vastly different than what I thought it would look like. So I'm just staying curious and open to the possibilities of how this work and how my career will continuously unfold. So
that's a great story. And thank you for being so transparent and honest with your personal history. I think that really helps to reduce stigma in general with addiction treatment, the more we talk about it. You said a lot of things were as you thought it would be, and a lot of things were different than what you thought it would be. Tell us a little bit more about that. What are some of the things that are different about this field that you've experienced?
Yes. So, first thing, I never could realize that I would write a book. And so that's a pretty neat accomplishment. I never would imagine that I would own a outpatient mental health practice where people love working, and we're able to have an impact on about 400 clients a week throughout the state of Kentucky. So I think that speaks to my hard work and my faith that I have in myself and really trusting, the process. And then I go back to the early days of my career when it was largely influenced by 12-step recovery, and that really changed my life, and abstinence-based treatment really, changed my life, and how that was very much at a time opposed to what harm reduction is. And so to see myself in abstinence-based recovery, that's what my process is, and to see myself able to have an impact throughout the state and the region and throughout, the country, and what recovery and treatment and harm reduction looks like, that is vastly different than what I had experienced early on. It's very, it can be seen as very contradictory to one another, but they're actually very complementary.
Absolutely. And for those of our audience who might not be familiar, can you explain kind of in your own words, what is harm reduction? What does that approach encompass? Why is it so crucial in addressing substance use disorders?
Yeah. Well, harm reduction is the reduction of harm. That's really the most simplest way of looking at it. And I think It's about safety. I think it's about true consent. I think it is about meeting people where they're at in the stages of change or wherever they're at in their motivation level to change whatever is going on. It is harm reduction is about public health. So it's about reducing disease. It's about reducing infection. It is about really treating people like people. And not saying that any other approach isn't, but it really is meeting people where they're at. And I think that it's so much more important now than it ever has been with how unpredictable the opioid epidemic is, and that we're seeing folks that, aren't experimenting with other substances like nicotine, marijuana, alcohol, and that they're immediately going to, other drugs, other substances that are contaminated by fentanyl, that are contaminated by xylazine, and it is, it's killing people.
Yeah.
Right. So we know that harm reduction, we know that it saves lives. We know that it is a very compassionate approach. We know that it is a real, there's an economic benefit to harm reduction in what it does. But more importantly, it's really about treating people like people. And it's interesting too, because when it comes to like the treatment of substance use disorder, it can be contradictory, like, well, we're enabling people, or we're co-signing on their stuff, or we're endorsing, drug use, or we're endorsing homelessness, or we're endorsing people injecting drugs by giving them, unused syringes. But if we look at like our society in America and the Western world, and maybe all of the world for the most part, we had harm reduction practices ingrained into our society. It's why we wear seatbelts. That's harm reduction. Every time I get into my car, there's some risk that I may get into an accident. But compared to how many times I've driven my car versus how many times I've been in an accident, there's a pretty vast difference. But it makes a difference if I get into a car accident and I'm wearing my seatbelt. There is, a higher correlation to being more safe and less injured. Using protective sex, harm reduction, brushing your teeth, as your dentist suggests, well, that's harm reduction. I don't want to go to the dentist and, have all of my teeth removed, and it's really simple when we start to look at in our daily life, how much harm reduction is baked into, our daily life. Smoke detectors in our home, locking our doors on our car, locking the doors on our home, that's all, those are all sort of in the same realm as harm reduction. Having a handrail going up a staircase, having crosswalks, intersections, those are all really harm reduction. It's all there to keep people safe.
Yeah, 100%. I love those analogies with the seatbelts, and I had never thought about the teeth brushing as well. I was going to ask you about misconceptions, but you've already addressed a lot of those. What are some of the key partners on the front lines of harm reduction, and what role do they play?
We could not do none of this work alone. We talked before we logged on about, parenting, and we talked about the parallels between like parenting and like mental health, treatment and mental health, prevention and awareness and stuff. And it's like, when I think about my children or think about kids, it takes a village, and really for anything that's happening in the village or in the community, it's going to take the community efforts to resolve those, and it's not going to be about one organization doing all the things for the community. It's going to be all the organizations doing their part for the greater community. That includes law enforcement. That includes first responders. That includes our emergency rooms. That includes our insurance companies. That includes our shelters. That includes our addiction treatment, our substance use treatment, and our outpatient practices. It is really going to take everybody to get involved. We saw in Kentucky this last year, we saw a decrease in fatal opioid overdose deaths. And the reason why, it's not because it's been one, magnificent organization. It's been because people have really started to see, if we're going to change the way things are being done, it's going to take all of us to do our part. But not to do just our part, is to do our part the very best that we can do, to a standard that puts people first, not profit.
I love that. And I love how passionate and well-spoken you are. There's a lot of tools that have been used and developed recently for harm reduction approaches. Can you talk just a little bit about the role that Narcan, fentanyl test strips, safe use supplies, HIV, Hep C testing, the role that plays in harm reduction and the importance of those tools?
Yeah. So let me say that Kentucky Harm Reduction Coalition, this is our 10th year of operating in the state of Kentucky. And shout out to the founders, Russ Reed and Donald Davis, who are no longer involved, but are certainly living their life of service to others still. And so I think that for our organization is really the undercurrent of what we do, is to really be of service to, our community by any means necessary, as long as it's ethical and as long as it's legal. I think that's another important aspect. Sure, there are people doing harm reduction work that is unsanctioned, with no real code of ethics to sort of operate by. And, these people and these organizations are doing good work. But to be out front, I think sometimes it really requires a certain level of values to be able to have an impact above ground. Mm-hmm. And when KYHRC, Kentucky Harm Reduction Coalition, by the way, you can check us out, kyhrc.org. When we first started, the bread and butter was naloxone. It was Narcan. And we've done a lot of that over the last 10 years. Not just, distributing it or giving it out, but we've done a lot of trainings for organizations, for churches, for individuals, for families, all over the country, really with the focus of in Kentucky. So a few years ago, we started mail-based distribution of our supplies, naloxone, Narcan, predominantly. So folks anywhere in the state can reach out through our website or give us a call, and we will ship them, naloxone at no cost to them. We do have, in Eastern Kentucky, we have a few addiction treatment centers that we collaborate with, that we ship monthly, hundreds of doses of naloxone to these treatment centers. In Kentucky, up until about a year ago, fentanyl test strips were illegal. And we just got the data. We're working on our annual report as this fiscal year is coming to an end. And last year alone, we were able to distribute on the street, in Louisville, Kentucky, and throughout the state of Kentucky, over 400,000 fentanyl test strips.
Wow. Congratulations.
Yeah. So what I think about that is that's potentially 400,000 doses that people were able to test to see if their substance was contaminated and poisoned with fentanyl. We also provide xylazine test strips, which is a recent thing over the last few months. We do syringe services. We have mobile sites. We collaborate with our local health departments. We collaborate with universities, Kentucky, University of Louisville, throughout the state. We just started this last year for incoming med school students doing naloxone trainings for them. It's really easy to talk to you about these sort of things, or my colleagues or people in public health, or people understand. The real go and how we're going to really move this thing forward is for us to get into the spaces where they're not talking about it. And that's even in healthcare. There are still pockets of healthcare that are really the conversations are not there. The training's not there. The education's not there. The use of the data and the science is not there. And that's that's a problem. I think the most important piece of harm reduction is education. Education to the participants who come and receive the services, that we offer, education to other healthcare professionals, other first responders, education to our children, our teenagers, education to the community at whole. And that's really the effort of what we're working on for this next fiscal year, to really hit a prevention-based model that relies heavily on education around harm reduction.
That's awesome. Where would you say, I couldn't agree with you more, there are gaps in education and understanding of harm reduction. Where would you say those gaps are still most prevalent that we as healthcare professionals and as a society should be focusing on?
In our educational system, one of the trends for overdoses is our teenagers is probably the most trending. And the problem with that, and what makes it different today compared to what it was maybe just not long ago. And I know even for me, when I was a teenager and I was using substances, the pill that I had was I knew exactly what it was. It came from somebody's medicine cabinet that was prescribed by a doctor. Now, was it overprescribed? Probably. I'm not going to go into all of that, today. The problem today is what looks like the pill a teenager is taking to be curious and to become intoxicated isn't the pill that they think they're going to take. These are pressed oxycodone, roxicodone. These are manufactured synthetically in a lab somewhere with the pill press. And so the Xanax it's not a Xanax. The Xanax could be xylazine and fentanyl.
Yeah.
And the other part about the education is what I believe in all of our schools, our middle schools and our high schools, just like we have our AEDs hanging on the wall, we also need to have naloxone free and readily available, so that and anonymously. So even outside of teaching some prevention-based curriculum, our middle schoolers and our high schoolers need access to naloxone, as well. And it's a bit of a double-edged sword, right? But we can no longer turn a blind eye to it. And we saw this in the 90s with underage teenage pregnancy. And, teaching abstinence from sex is really the best way to prevent pregnancy. Mm-hmm. Maybe in theory, but what we saw was an increase still in teen pregnancy. So if we don't transform how we're interacting with our kids and our teens, then we're going to see more and more reports, more and more reels. We're going to see more and more stories in our newspapers, online, and in our different medias about our children dying from a fatal overdose, which is probably 100% accidental.
Mm-hmm. Mm-hmm. Gosh, so powerful. I think your emphasis and focus on not only educating the public, but educating our young people who are most vulnerable and most at risk. And so many great analogies you gave there. Well, Henry, thank you so much for joining us today. We're so glad that for the important work that you're doing. And thank you, listeners, for joining us at the Well Aware podcast today. Remember, you can follow us on social media. Take care of yourself and others. Thank you so much for joining.
Thank you.